Good afternoon, dear friends. I once again welcome you all to our Zoom platform with another power-packed webinar. After the success of our GNM workshop last month, today we have our key speakers, Dr. Santosh Kumar and Dr. Ehab Makki, who will bring to us an insight about how we can incorporate GNM to benefit us in our clinical practice. I welcome Dr. Ehab to take over the platform.
Thank you very much, Dr. Ritu. Thank you very much. Actually, as we know, I am homeopathic practitioner, and since has been introduced GNM and introduced GNM practice, it makes huge difference in treatment and understand the inner psyche of individual. Today, I'm here to discuss about atopic dermatitis or eczema. I'm going to talk about two portions. The first portions about eczema is not an allergy disease, and the second portion about the eczema and the conflict. Let me first share my screen. It's okay?
Yes.
Yes, we can see. And I would request the other doctors to please keep themselves mute while the speaker is speaking. Thank you so much.
Eczema or atopic dermatitis, it is the most common in our daily practice. And eczema, as we know that is once you diagnose as eczematis, you will be eczematis patient forever. And once they put you in anti-allergic medication or antihistamine, you are going to use that medication forever. And that it shows that is the diagnosis and the treatment either is not matching or still we are not understand what is the roots of problem. Still, we are not understand what is the underlying cause. Because the moment you diagnose eczematis, you will be eczematis forever. So how eczema define? How we can define eczema as per as the academic Americans and National Allergic Institute. Eczema is defined as an inflammatory condition characterized by itchiness. That itchiness make you scratch. Scratch make you itchiness. So more you scratch, more you itch. More you itch, more you scratch. And that form scratch, itch cycle. And eventually it causes rash, and then scaling, and then hyperpigmentation. And the question that, what is the cause? What is the cause of eczema? As per American Academy of Dermatology and the National Institute of Allergy,
Dr. Ehab, sorry to interrupt. Can you make it full screen for your presentation? It's not full screen.
Yeah, actually, but you can see because for me it's simple to understand.
Okay, okay, fine. That's okay. That's okay.
Let me try full screen, but okay.
Yes,
okay.
That's better. Yes, perfect. Thank you.
No problem. So the cause, as per as American Academy of Dermatology, is the result because of immune system. It's the reaction of immune system. So once the allergen get inside, once the chemical get inside the body, once the pollen get inside the body, the immune system overreacts. Whereas in the normal persons, the immune system normally reacts. So eczema is defined as overreaction of immune system as per as American Academy of Dermatology. And the guidelines and broke histamine, that is the cause of inflammation with those drugs. With the results, once you used antihistamine, you'll find the patches, the rash disappear. And once you disconnect it, the symptom reappeared again. And therefore, there is no cure. However, there is millions of prescription of antihistamine every day for problem where there is no cure. What is the truth? What is the reality? In order to understand the truth, in order to understand the reality, we need to have a quick revision about anatomy of skin. Skin include epidermis, dermis, and hypodermis. So there is 3 layers: epidermis, dermis, and hypodermis. Eczema is the problem with the epidermis. So out of 3 layers, eczema is a problem with the epidermis. Since the problem from epidermis itself is composed of 5 layers. The topmost one is stratium corneum, and then stratium lucidum, and the third stratium granulosum, and then stratium spinosum, and then stratium bacilli. Eczema is a problem with the topmost layer, stratium corneum. So out of skin, eczema is a problem with the epidermis. In epidermis, stratium corneum is the eczema problem of stratium corneum. So our topic today, we are going to focus on stratium corneum. First, stratium. What is the meaning of stratium? Stra means layer. Corneum means horny or tough and strong. This layer made up from dead cell. It is basically dead. Inside the cell, there is specialized protein called keratin. And that makes these cells tough and strong. And this stratium corneum, it is like wall. Will not allow allergen to get in, will not allow fungal to get in, will not allow irritant to get in, will not allow chemical to get in. That is how it's made. So stratium corneum is like wall, it's like army. No matter what you do, nothing it goes inside. We are living in the environment full of dust, full of chemicals. Still we don't have problem because our stratium corneum is tough and strong. Now let us see the first scenario. When the stratium corneum is tough and strong, so the irritants around us, the allergen around us, it is impossible to get inside. And that is the reason you don't have problem with the eczema. And that is the reason you don't have rash, because stratium corneum is strong. The second scenario, if the stratium corneum is weak, where there is hole, or there is crack, or there is ulceration, so allergen can get inside the body. Chemical can get inside the body. Irritant can get inside the body. And the immune system will not keep silent. It has to react. So when the immune system reacts, because there is something get inside the body, that is why the immune system reacts. And that is, it shows the immune system, what is right, it is a normal phenomenon. It is not as they taught us in the books, the problem is the immune system. If someone gets inside your body, you have to react. You have to produce antihistamine, you have to produce IgE antibodies, and that causes inflammation, and because of that, there is rash, but that is normal. So what is the real cause behind it? Is it because of immune system? Is it because of overreaction of immune system? It is normal. Is it because of allergens? We are always blaming the allergens. When you keep the windows open, when you keep your door open and you find there is dust, it's a problem with the dust, or because you forgot the windows open. It is similar. We cannot blame allergens because the door is open. What is the truth? what is the reality. And reality and the truth, eczema, it is not an allergy problem. It is not because of overreaction of immune systems. It is a problem with the stradium corneum. It is a problem with the wall that is, it is weak. It is dysfunction of skin barriers. It's nothing to do with allergen. It's nothing to do with the overreactions. So what is the cause? Why is stradium weak? Why is there a dysfunction of the skin barrier? Before 2006, the exact causes, nobody knows why. And always blame the immune system, always blame the allergens. But in 2006, the Professor Makki from Dent University, Scotland, he identified a specialized protein. And that protein, they call it filaggrin, which is found in the third layer. The third layer, granulosum. And the main function of this protein, first of all, it makes the keratin, I have to do it to show, it makes the keratin, this is the keratin, tough and strong. That stradium corneum made up from dead cell, and it composed of a specialized protein called keratin. The toughness of this keratin because of filaggrin. A part of that stradium corneums, there is a specialized factor. They call it natural moisturizing factors that regulate the water within stradium corneum. And because of that, our skin is hydrated. So when we're losing water because of exposure to the sun, these factors restore the water back with the help of filaggrin. A part of that is the water. The water, it makes the keratin tight and tough and strong. There is no gap because of the water. So filagrins play an important role as far as the power and strength of stradium corneum that produced by the third layer, stradium granulosum. That is why our skin is healthy. If there is the second scenario, if there is deficiency of filaggrin protein, so what happened? What is the result? If there is deficiency, first, the keratin, it will be weak. It will not be tough, strong. The keratin of stradium corneum, it will be weak. And the most important that the water that is in stradium corneum is start to leak out. And that is why skin becomes dry. So the water, it will leak out. Keratin, it will be weak, water leak out, and there will be gap between the cell through which allergen can get in, through which chemical can get in, through which allergens can get in. Because there is gap, because there is ulceration. And when it gets inside the body, the immune system will not keep quiet. It has to react. Then it produce large amount of histamine antibodies to fight against the allergen, to fight against the irritants. And when it produces in the large amounts, histamine irritate the nerve ending of the skin. And because of that, you start itchiness. You start feeling of itchiness because histamine irritates the nerve ending, and that makes you feel itchiness. And because of that, you start scratching. And more you scratch, more you damage the stradium corneum, and more allergen get in, And that is why more you scratch, more you itch. More you itch, more you scratch. This is a scenario. So Dr. Makki, he discovered that the scenario of eczema is because of deficiency of flavonoid protein that cause dysfunction of stadium corneums. And he found that deficiency only, it causes eczema. Lack or absence of flagrins, it leads condition called ectosis vulgaris. It is severe form of eczema. You see, there is dryness because there is no filagrin to reserve the waters. And that is why the entire body eczematic. And this condition is the result because it's totally absent of flagrins. And therefore, eczema, it is not an allergic problem. Eczema, it is a problem with the stadium corneum because of deficiency of flagrins. And that is why once you diagnose eczema and using antihistamine medications, you are going to use that forever because that is not the real causes. We are blaming histamine, but in reality, that causes something else. So what is the cause of filagrin deficiency? I have been asked this question a long time. I'm always asking myself why there is deficiency of filagrin in eczematic patients. I went to more literature, tried to find out more books. I never get the answer. And the answer always, it is a gene faults. It is a genetic problem. Even if it's gene fault, what is the cause of the gene fault? Till I come across with the GNM and understand that there is link, there is cause behind that. My second portions, and I'm going to discuss about this eczema and GNM later on. Now, as far as the GNM, for those who have no idea about the GNM, is German new medicine, the founder of GNM, Dr. Hammers. And Dr. Hammers, he is the founder of the GNM, and this is the most beautiful science also. He discovered that there is 5 laws. In order to practice even GNM or understand GNM, first you need to understand the 5 laws, the 5 principles. It is not 500, only 5. What he discovered, Dr. Hammer, first of all, each cell, each tissue, each organs controlled by specific neurons in the brain. So there is a specific neuron in the brain control the kidney. There is a specific neuron in the brain controls the genitalia. There is a specific neuron in the brain controls the alveoli of the lung. There is a specific neuron controls the bronchiole and so on. So Dr. Hammers, he discovers that the first biological law, first of all, life is full of problems. It's full of difficulty. It's full of troubles. We are always under stress. Continue from this stress to that stress. He discovers that is the shocking news, unexpected news. And the shocking news is different from person to the person. It may cause you shocking news, for someone else is not. So it depends on the individual perception. But he discovers that is the shocking news. You lost your father. You lost your business. You receive a letter of termination you never expected. He discovered that a moment you receive this shock, it causes injury in the brain, in some neurons. It causes inflammation of the neurons in some part of neuron. It causes lesion. So a moment you receive the shock, that shock, it causes lesions in the brain. And then, as we know that each organ, each tissue is controlled by a specific part of the brain. So it depends on the corresponding area of the brain. If it is involves the neurons that controls the kidney, you will have kidney problems. If it is involved the neuron that controls the lungs, you will develop lung disease. So it depends in which neurons and what area control it. The second biological law, a moment you receive the conflict, a moment you receive the shock, he found that is a specific area that is involved or neuron in the brain. It will initiate two phases. First, they said conflict, active phases, and healing phases. So a moment you receive the shock, this is a switch on sympathetic nervous system. There is increase of heart rate, your blood pressure, it goes up, and a part of that, there would be vasoconstriction of the blood to peripheral, to the skin. And that is why you'll find the skin is cold. There is coldness in the feet. There is coldness in the hand during active phase, a moment you receive the shock. Insomnia, because the stress hormone is too high. And when normally we get up early morning, the cortisol normally it is too high, and because of that we are active. When time it goes on 3 o'clock, 4 o'clock, the cortisol it goes down, and that is why we feel exhausted or tired. And then melatonin hormone it goes up at 9 o'clock, 10 o'clock, we go into sleep. But during active state, the stress hormone is too high. And that is fine, difficult at night to sleep. And then follow this phase, we call it healing phase, where the conflict start to resolve and the parasympathetic nervous system take overs. And because of that, the heart rate goes back normal. The blood pressure goes back normal. The blood supplies the skin. It becomes warm. Sleep is getting better. Dr. Hammer also discovered that is the location of the lesion. In the brain, there is billion and billion of neurons. So when you receive the shock, which neuron involved? Is it a neuron of frontal lobe? Is it a neuron of brainstem? Is it a neuron of occipital? Which neurons? And he found that it's the type of shock, the kind of shock, it determines which neurons involved. If you receive a shock, you lost your business, and you spent huge amount to build your business, and suddenly you receive a call, you lost everything. And he found that this shock involved cerebral cortex, specialized neuron, control the coronary arteries. And this guy, he will develop coronary heart disease, or myocardial infarction. So the location of neuron, it depends on the kind of the shock, which shock. If you receive shock-induced frightening death or death-frightening shock, that it will involve a specialized neuron in the brainstem that controls the alveoli of the lung. And therefore, this guy is going to have problem with the lung. So the location, it depends on what type of shock. And it is very obvious in the CT scan. And that it makes GNM is scientific. Because a momentary shock, it shows in the CT scan, which is visible. That is why GNM, it is the only science, even in psychiatry, even in psychologists, they could not prove it. But GNM is the first science to explain scientifically. I already spoke about. Now, eczema. Therefore, there is 5 biological laws. The first one, the lesion, when you receive the conflict, and the second one, after you receive the shock, the actions of this shock inside the body, and the third one is very important, is that because each part, now eczema is a problem with the epidermis. Epidermis originated from ectoderm. What is ectoderm? What is the germ cells? Because the psyche and the lesion in the brain affect specialized germ cells. So what is germ cells? To understand this, we have to have quick revision about embryology also to understand the germ cells. Because the concept of GNM depends on formation of germ cells. Now, as far as the germ cells, after fertilization, shortly after fertilization, zygote is formed. And the zygote is a single cell. 24 hours, these zygote multiply into 2. 48 hours multiply into 4. And then 8. And then 3 days after, it multiplies into 16. And so on. And eventually, after 5 days from fertilizations, the cell divided into 2. So after 5 days from fertilization, the cell, there is mass of the cell divided into 2. And this stage, they call it branch 2 cyst. Group, they call it inner cell mass, and that is the future baby. That is the one going to form the organs of future baby or embryo, the inner cells. Whereas the trophoblast is the one that feeding these cells, the future baby. And trophoblast is going to become placenta in future. After 3rd week from fertilization, these inner cells differentiated into 3 layers. And that 3 layers is going to form the entire human beings. They're going to form the organs, they are going to form the muscles, they are going to form the skins from only 3 layers. So after 3 weeks from fertilization, the inner cells is what differentiated into 3 layers: the ectoderm, the mesoderm, and endoderm. The ectoderm is the one that responsible of make the outer structure, like skin, epidermis, like the orifice, nostrils, like oral cavity, like anal visuals. And the mesoderm responsible makes the ligament and the muscles. And endoderm responsible makes the lining of the organ and the organs. So out of 3 layers, ectoderm, mesoderm, endoderm, for me is important ectoderm because my topic is epidermis. So ectodermis is the one that responsible of make epidermis. It makes nostrils, it makes the oral cavity and other parts. So when you receive the psyche, that psyche in the brain affects the germ cells. When you say germ cells means ectoderm. And the most important now, as far as the shock that is involved ectoderm, it will explain later on. First, we need to understand what kind of conflict affect epidermis. What kind of conflict? The most important conflict that it cause problem with epidermis, they call it separation. Separation conflict. And separation conflict, we know that as human beings, we are always attached to each other. You'll find you are attached to your father, you are attached to your mom, you are attached to your kids, you are attached to your husband, you are attached to your wife, you are attached to your job. Any severe separations, your wife run away from you, you separated from your kids, you receive termination from job, this is create detachment and that calling separation conflict. So separation conflict means is related to relations. The conflict that related to relation, you have to remember this. Whether you lost your father, whether you lost your wife, whether you lost your kids, whether you lost your job, whether you lost your business, this is called separation. And when you receive this separation, second question, what part of the brain affect? And I have already explained that the location in the brain, it depends on the type of location. So in case of separation, what type, what part, what neuron involved? Dr. Hammer discovered that the ring, it formed in sensory cortex in the brain. So in case of separation conflict, this conflict, it causes lesion in the brain, it causes injury to the brain, where? In the sensory cortex. And that will control ectoderm. And that will control ectoderm. And that will control epiderm, the outermost layer of skin. You see the connection, it goes so scientific. So when you receive the psyche, that once it causes problem with the epidermis. The psyche, because of separation conflict, it causes lesion in the area that control epidermis and then result in dermatitis. Brain is divided into two. We know that there is right hemisphere and left hemisphere. So there is right sensory cortex and there is left sensory cortex. If the lesion that the ring form in the right sensory cortex, this guy will develop eczema on the left side. If the lesion on the left side of the brain, this guy will develop dermatitis on the right side. Now, the most important you need to understand during the conflict, the epidermis during active conflict, we spoke there is active conflict that triggered sympathetic nervous system, if you remember, And there is healing that when the parasympathetic take over. During the active stage, so what happens? There will be loss of epidermal cells. There will be loss of epidermal cells, like a keratin. And because of that, there will be gap. There will be ulceration. And the skin is dry. And a part of that skin is cold because there is vesicle obstruction. So less blood reach the skin. And during healing process, there will be proliferations. The more skin is formed. We'll discuss this later on. Now, what exactly happens? When I went through GNM, I found that is during active state, when the psyche involves the sensory cortex, this initiate biological program that the skin, the cell of, that cause loss of epidermis. And I've tried to find out how, which layers. And eventually, when I study filagrins, it's not mentioned in the GNM, but I connected that is the shock. It's definitely caused deficiency of filagrins. That is the psyche part, is definitely cause deficiency of filagrins protein. And when filagrin protein is less, so the keratin is weak. And the water, it leaks out, and because of that, the skin is dry. So the effect of the psyche is most likely on filagrinous proteins, because it's the one behind the entire concept. Now, we understand that any dermatitis or eczema is the result because of separation conflict. And now we need to remember, because right side is different than left side. So when the patient presents with the right-sided dermatitis, what kind of separation conflict with whom? Right side present the father, friends, business, husband, wife, business partner, neighbors, relatives. So the right side, it makes you think this patient, he may have separation conflict with those guys, either father, husband, wife. Whereas the left side, when a patient presents before you with left-sided dermatitis, mostly has separation with the close family, the mother, brother, sisters. So to remember, the left side's closed. Who's closed? Father. Who's closed? Brother. Who's closed? Sister. Not wife, not husband. So I have husband, right side. So this is to make you to remember. Okay. Now, let us see the scenario when there is separation conflict or eczema in newborn baby. How we can analyze this? In newborn baby, a baby who born with eczema, now we understand this is separation conflict. Definitely is not the one who caused. So the problem with the mother. That is why in a patient, in newborn baby, we normally focus on the mom. Why mom have separation conflict? If the mother not happy with pregnancy, she came to know she's pregnant, that pregnancy affect her job, that pregnancy affect her freedom, that pregnancy affect her looks. She's not happy at all with the pregnancy. She's not happy with the child inside her uterus. And these feelings develop. and eventually will destroy the bonding relation, cause detachment between her and her own child. And that feeling is transferred to the child. And this child, he will born with separation conflict from the mom, and the most important, which part? Look and diagnose. That is the beauty of GNM. When a child born with the eczema in umbilicus region, because that is connected the mother to her own baby during pregnancy, and that bonding destroyed, and therefore he born with eczematous rash on umbilicus region. Usually, child born with eczema in the cheeks, in the chest, but not in this area. Second, when pregnant woman came to know that her own husband, he might be having affair with someone else, she's no longer attracted. And that feeling is developed, is strong, and eventually cause separation. It destroys the bonding that her husband's, he have affair with someone else. There is something going behind. So during pregnancy, her child born with separation conflict on his back. There is rash on his back. Continuous ultrasound. During pregnancy, the fetus connected to the mother through heart. Apart from that is the sound of our heart always there. Continuous ultrasounds, it caused all the separation conflicts. I've tried to understand why, I couldn't understand why. But the child born with eczematous patch on the ear, external ear. In a woman who are not happy during pregnancy because there's no care. She might not getting care because of her husband. She's not getting care because of her mother-in-law or sister-in-law during pregnancy. There is ignorance. She develops also separation conflict, and a child may born with any type of rash. We have seen in newborn. Let us see in children why there is eczema as far as the concept of GNM. Now, in children, if the child born normally, there is no eczema in the past, and suddenly develop eczema. One of the most important cause, if the child lost his father, or if the child lost his mother, or if the child separates from his father, or if the child separates from his mom, that also cause separation. And it depends. If dermatitis on the right side, if from father, you'll find dermatitis on the right side. If from mother, you'll find dermatitis on left side. This is the most common problems. When second child arrives, and you find that is the first one, there is ignorance. The family are very busy with the new one, and they ignore the first one. And this child will develop second child syndrome. They also develop separation conflict, and that lead to eczema. That is the question what we are going to ask. This is the most common. Fighting parents always involved in fightings, and this child also ignore and will develop separation conflict in the form of eczema. Let us see the scenario in case of a woman after married. This one, she developed eczematous rash on right arms after married. She has no history of eczema during childhood. She has no history of eczema during teenager. She developed this problem after she got married. Since there is eczema, that means there is rash. And since there is rash, that means there is separation. With whom separation? Definitely it's not with her father. Where is right side? Right side including father, friends. So mostly it might be husband, because she developed this problem after marriage. What is the cause? So to remind you, right-sided include father, friends, husband, wife, neighbors, relatives. You have to remember, we have to mug up this one. What is the cause? If she came to know she married wrong guy, always there is conflict, always there is problem. Simple problem, he make it big problems. And eventually, it will tear up the connection, the bonding relations destroyed. And she developed separations, conflict, and which it may show in the left sensory cortex. She married the wrong guy. And eventually, she developed separation. And that is why now she presents before you with the rash on the right hand or the right side. What is other example of separation conflict in case of post-married woman? She presents before you with the rash on her back. And make sure that she have no problem before. There is no eczema, there is no history of eczema during childhood. For first time, she develops this after marriage. So what happened in her back? This is mostly happens when she came to know her husband is deceptive. He was not honest. Whatever he told before marriage, it was just liars, cheating her. And that is affect the bonding relations, because she came to know she's married deceptive husbands. And that destroys the bonding, and eventually she develops separation, conflict, and that is present in her back. Now, she presents before you with the medial aspect rash of skin. It could be in the side, it could be in the arms, it could be in the forearms. What is the meaning of rash in the medial aspect? We know that this separation, but with whom? What kind of separation? When there is separation against her desire, she loves him, but unfortunately, he selected another woman, or he divorced her. There is separations against her wish. She's trying to work hard to keep the relation, but separation took place from his side. She wants him, and therefore she developed rash on the medial aspect. If the rash on the lateral aspect, we have seen that when the rash in the medial, there is separation against her desire. But now she presents before you rash on the lateral aspect. There is separation. What is the cause on the lateral? She came to know is not the right person. She doesn't like him, and she wants to get rid of him. She wants to divorce, but because of tradition, because of social, she has to stay with him against her wish. And that is why she developed eczematis on the lateral side. From here, what we understand? If it's medially, there is separation conflict against her desire. If it is lateral, she wants the separation but find difficult to get rid of it. If a woman sexually not satisfied, majority of women, even if sexually not satisfied, it may not make difference for them. They may not even care. It will not cause any separation for them. But there is some women, this is very important. If she is not, the bonding relation between her and her husband will destroy. She will not accept him. And this when she also developed separation conflicts. And because of husband, it will be in the right side. And because she wants to get rid of him, it will be in the lateral aspect. Look and diagnose is very important in the GNM. We have seen a newborn child, the umbilicus regions. That is when the mom, she's not happy with pregnancy. When in her back, when her husband might be having external affair, this because of ultrasound, and this because she was not taking no one care of her during pregnancy. This in children when he or she lost father or mother, and this is a second child syndrome. And similar to this, we have already gone through this one. Thank you very much, friends. Again, thank you very much. And I will ask my friend, Dr. Santosh, to continue. And before that, I would like to also thank Dr. Farouk Mutwala, who opened our mind for GNM. And also I would like to thank my friend, Dr. Santosh, because he's the one that is for years asked us to involve in GNM. Thank you very much. Okay.
DrEhab. You are stop viewing your screen, DrEhab. DrEhab.
Yes, I'm here.
Okay.
Okay, I've done it.
Yeah. Yes. Thank you, Dr. Hab, for a wonderful session. I think you've summed up one-day workshop, which we did that day in just 1 hour. I think it was excellent. Really. I mean, you've crossed all other doctors who presented. It's really good. It's really good. And it really shows the hard work that you have put in preparing this presentation. I think it was really good. So now I would welcome Dr. Santosh. I think he would take over and he will go further on this. Dr. Santosh, can you please take over and we move
I can
forward.
share the screen?
Yes, you can.
Is it visible, Dr. Ritu?
Yes, yes. Can you make it full screen, doctor?
Yeah, yes. Yes. Good afternoon to all of you. Thanks, Dr. Ritu, for the introductory remarks. Dr. DrEhab, wonderful presentation. So the purpose of ours is to apply, how to apply this GNM knowledge in our day-to-day practice. Because we have been working with this one for the last so many years. But recently, after a workshop done by Dr. Motiwala, we all could able to come up, find solution for our rubric selection. So our aim is to find rubrics depending upon the application of this GNM knowledge, so that it will be very easy for us to do in our day-to-day practice. So before starting, I would like to take the blessing from our master, Dr. Samuel Henneman, who left us with a beautiful science. Secondly, I would like to take the blessing from my guru, Dr. Praful Vijayagar, who introduced GNM and its technique years before. But it takes long years for all of us to come with this solution. Thank you so much. Before going into this one, I would like to just rush up with this kidneys, because Dr. DrEhab has beautifully presented about the skin epidermal disease, especially the separation conflict. But it covers only one germ layer. Today, I am going to discuss about kidneys. Just have a look. Kidneys are a pair of bean-shaped organs side is little bit lower and left side is a little bit up because of the liver. Make space for the liver. It weighs about 110 to 140 grams and it's 6 centimeter wide and 12 centimeter long. And the basic function, you just go with the function. The basic function of the kidney is to filter the blood. Approximately 180 liters of blood has been filtered daily by the renal parenchyma. These are the three structures which is there in the kidney: renal parenchyma, kidney collecting tubules, and the renal pelvis. These three structures are very important for the functioning of the kidney. Renal parenchyma forms the bulk of the kidney, and its function is to filter the blood. As I told you, nearly 180 liters of blood per day it has been purified, and 95% of this filtrate has been reabsorbed by the loop of Henle and other tubules, and only 5% is going out to the collecting tubule, through which it is going through the ureter. Then Dr. DrEhab has already described about the embryological function. It is very important for a practitioner to have a thorough understanding about the three germ layers. That is why I am also emphasizing about that embryogenesis. Actually, it is a process of initiation and development of an embryo from a zygote. How this process is going on and how these three germ layers are coming up. That is what we are going to explain now. After fertilization occurs in the fallopian tube, the zygote begins to divide into fallopian tube itself. First, into a two nucleate cell in the first day itself, first day of fertilization itself. And series of consecutive mitotic divisions occur in the fallopian tube itself, which will come into 2 goes to the 4, 4 to the 8, 12. When it comes to the 16 cells, it is called blastomere. It is on the 2nd day of the fertilization. From this blastomere, it goes to the 3rd day. That is called, this blastomere or this 16 cells are called morula because of its mulberry-like appearance. And it enters the uterine cavity on the 3rd day, where it looks, all the cells look like same. Now, this has been differentiated into inner cell and trophoblast. You see, this is the inner cell and it divides into trophoblast on the 4th day of the fertilization. Okay. And on the 5th day, these inner cells are moving towards the end of this one, and the inner cell mass will be clubbing near the other side. That is called cavitation. That will be close to the uterine wall, and this inner cell mass will become the embryo, as said by Dr. DrEhab, and this one will become the placenta. And on day 7, implantation is there. There will be development of cell mass differentiation on the 8th and 9th day of implantation or fertilization. So on 8th day, this inner cell mass will be divided into 2. That is called bilaminar disc. First production of first germ layer, that is endoderm, has been developed, and the second one is the ectoderm. Upper side becomes the ectoderm. That is on the 12th day of fertilization. Then it goes into a trilaminar disc formation. That means in between the ectoderm and endoderm, one another layer is coming, which is called mesoderm. So on the day of 12 itself, ectoderm, endoderm, and in between mesoderm is forming. So this mesoderm is formed by the primitive streak, you see, and it spreads all over, and it is divided, it is going to the head part, you see, going to the tail part. By that way, the embryo is developing. So within 15 to 20, 23 days itself, 3 germ layers are developing inside our body. The importance of 3 germ layers are, these 3 embryonic layers will be there till the end of no differentiation. One germ layer never comes to the another germ layer. Endoderm will be endoderm till the end of your life. Ectoderm will be ectodermal layer through the entire life. The tissues and organs are derived from these 3 embryonic layers. So these 3 embryonic germ layers are very important for us in understanding GNM theory. These are the 3: ectoderm, mesoderm, and endoderm. What is? Now comes the importance of this one. All these 3 germ layers in the zygote has been controlled by 4 areas of the brain. In our brain, there are 4 areas. These 4 areas of the brain has been controlled by these 3 germ layers. The 4 areas are, first is the brainstem control area, second one cerebellum control area, and the third one is the cerebral medulla controlled area, and the fourth one is cerebral cortex control area. This brainstem has been controlled by endoderm. So all the endodermal structures are derived from brainstem, controlled by brainstem. Okay, and the cerebellum has been known as old mesoderm. All the structures produced by this cerebellum is called as old mesoderm, and all the structures which coming from the new mesoderm is called cerebral medulla. That is called mesoderm. Cerebral medulla and cerebellum two constitute the mesoderm, and the cerebral cortex constitutes the ectoderm. So, depending upon the area where it has been, the organ has been developed, the control area changes. This is the importance of GNM. Okay, so when human beings are come together, conflicts are bound to arise. At least honest differences of opinion will crop up when human beings are joining together. These are to be dealt with as early as it has been noticed. We have been dealt immediately, it has to be dealt. Otherwise, if this conflict has been allowing to grow beyond a limit, that will affect a person's health and well-being. The psyche is the one. Whatever you think, whatever you feel, whatever you perceive will register on a particular part of the brain which have connection with that particular part of the body. This is the beauty of our body. So whatever ideas you are generating, that will affect the particular part of the brain which have effect on the body. So according to GNM, the diseases are not really diseases. These are a specific biological special program organized by the brain to overcome this psyche. Whatever thought process you are having, that will be registered in the brain and will be showing us in the form of signs and symptoms in the body. So most of our organs are derived from one germ layer, as said by DrEhab. Skin, epidermis, has been made by one single germ layer. But some organs are composed of either 2 or 3 in case of alimentary tract. Whole alimentary tract has been made by the endodermal tissue. But the entrance and exit has been controlled by the ectoderm. So 2 germ layers are there in this particular alimentary system. In case of skin, epidermal layer, DrEhab has clearly explained about the separation conflict and how that affected in this one. But in case of alimentary system, there will be 2 conflicts. If it is inside the alimentary tract, there will be a morsel conflict. Something has taken but cannot able to omit out. That might be the conflict in this case. And in case of outer, this one, I wanted to take something, that is ectodermal, or I wanted to expel something, that will be the another conflict. But in case of kidney, you see there are 3 layers: kidney parenchyma, kidney collecting tubule, and renal pelvis. In that one, this kidney parenchyma has been controlled by new mesoderm, and this kidney collecting tubules has been controlled by endodermal germ layer, and this renal pelvis has been controlled by ectoderm. So 3 germ cell layers are there in kidney collecting tubules. So whenever 2 or 3 layers are there in a system, there will be different conflict affecting different area. You see, kidney collecting tubule, that is the endodermal. You know, endodermal layer is the first layer which is formed in the body. The life starts from the water. Okay, so endoderm is the first one which started, followed by ectoderm. I already told you, whenever the life, the life comes out from the ocean or from the sea, they want to get protection from the sunlight and other approaching enemies. To avoid that one, ectodermal tissue forms. Then in between, mesoderm comes. Why? They need locomotion to run and this. So this is the way how the body has been made inside our womb. So in this, the first thing which I am going to tell is the kidney collecting tubule. The function of the kidney collecting tubule is to, this is the kidney parenchyma. Whatever urine has been formed inside the kidney parenchyma, it has been funneled to the cup-shaped calyces and keep it there, and it has to be passed through the renal pelvis. This is the function of this kidney collecting tubule. It will pass from this kidney, so this collecting tubules to the renal pelvis for the excretion. So the kidney collecting tubules are the oldest evolution in terms of kidney because it is the endodermal tissue. So the conflict, the biological conflict which connect with the condition in this kidney collecting tubules are, the first one is fugitive conflict. That means fugitive is a conflict or a person who is on the run or who has escaped from something or he has been hiding. That is called existence. How I can exist in this world. My job has completely gone. I have been thrown out somewhere. So I have been isolated or abandoned. Or conflict of feeling too little. I don't have enough water to drink. You see. So this will be abandoned, existence, or I am like a refugee in one place. Somebody has to help me. I don't get enough water. Somebody has to. These are the conflicts which affects the kidney collecting tubule. And whenever this conflict comes, what will happen in endodermal layers? Actually, it has been coming from the intestinal cylindrical epithelium. So it will be cylindrical layer will be there, and there will be increase in the cell growth. The growth of the cells will be increased so that the water can be stored there so that I can stay long. This is the conflict that you said. What is the feeling? Biological purpose of cell increase is to hold the water and other urea, other creatine, other contents will be more at that. So whenever that feeling will be there, and if that feeling stays in, how long it stays, depending upon the intensity of the conflict, the water clogging and other things will be there in this particular stage. So whenever this water, whenever this will be there all over the body, increased level of uric acid will be there, increased level of urea and creatine will be there, and there will be decreased urine output. So that what is the purpose of this one? So that I can stay long. So whenever the conflict got resolved, Biological meaning is hold back water and urea. I would like to hold back all these things so that I can stay long. And whenever the resolution starts healing, that whatever the increase of the cell growth will be there, that will start degrading, as a result of which more urine flow will be there. There will be increased urine content, and the urea and other things will be decreasing from our body. This is the conflict which affects the endodermal layer, which is the kidney collecting tube. Then comes the kidney parenchyma. Kidney parenchyma is the one which forms the bulk of the kidney. The main area or the main functioning of the kidney is being done in the kidney parenchyma, composed of millions of nephrons. And its function is to filter the blood and produce urine. The filtration process has been done in the kidney parenchyma. And each nephron consists of glomerulus, glomerulus, which has been covered in the Bowman's capsule. So it is the blood pressure which regulates the blood flow inside the Bowman's capsule and the small blood vessel, keeping the kidney function normal. So whenever you are having some conflict, that means water conflict or fluid conflict is the conflict which has been mentioned, because water conflict means if our place has been flooded by water, that is called water conflict. Or if someone fall into in some pool or some ocean where I cannot able to swim, non-swimmer in the sea conflict. Okay, or water conflict, too much water is there, or water leakage, pipe leakage causes so much of water. This is the conflict. Or the fluid conflict, another is called whenever you are going for an injection. Some people will be very afraid of injection. That's called fluid conflict. So if that type of conflict comes, in case of kidney parenchyma, in the endodermal tissue, there will be first cell multiplication followed by cell degradation. In case of mesodermal layers, there will be first cell degradation, necrosis will be there in one or more places. So whenever the necrosis comes, as said by DrEhab, there will be vasoconstriction will be there. Blood supply will be less. More blood pressure will be there to push that blood, as a result of which hypertension will be the effect. Elevated hypertension will be the effect in this one. And if it stays low, this elevated hypertension can cause other problems inside the body. This is the active. And the biological meaning of this cell degradation is to make more space so that the filtering capacity and the urine making capacity will be more. So all symptoms which we are seeing in our body is having biological meaning. So in case of kidney parenchyma, the conflict will be water conflict followed by necrosis of this one. And whenever the healing phase comes, the cells will be replenished or the normalization of the function will be there. There comes the need of bacteria and viruses. In the fourth, as said by DrEhab, up to 3 biological law, he told. The fourth biological law is the viruses, bacteria, fungi are not enemies. They are the one which reduces or replenish the cells which has been formed during the conflict active phase. If that virus, bacteria and other thing is not there, then the degradation will be affected. It leads to other kidney cyst for renal cyst formation will be there. Nephroblastoma can come. So much of conditions can come. So this is the conflict which is there in renal parenchyma. That is called mesodermal layer disease. Then comes renal pelvis. Renal pelvis, the function of the renal pelvis is to funnel the urine which has been coming from kidney collecting tubule and send it to the ureters and taking it out. And it has been controlled by the ectodermal layer. Ectodermal layer. So all the openings, this tube, everything will be covered by ectodermal layer. And the biological conflict related to renal pelvis is the territorial marking conflict. Territorial marking means I cannot able to mark off my territory depending upon their gender, because in ectodermal diseases there will be laterality, as said by DrEhab. Right side will be for the husband, job, and the left side will be for the mother, pets, child. It stays only mainly in the ectodermal layer. So the territorial marking conflict is the one which called someone has intruded into my territory. You know, the wolves and the dogs are marking their territory by urinating. So I cannot mark this territory. Somebody has entered. I cannot mark this territory. Okay. So this territorial marking conflict is the basic reason for this renal pelvis diseases. And whenever the conflict is active, there will be same necrosis, cell degradation of the renal pelvis mucosa, so that more urine production can be there to mark that territory. This is the thing which we have to know, biological meaning. Enlarge the volume of the renal pelvis so that the widening the ureters and they will be passing. Okay. And in the healing phase, as said by DrEhab and me, there will be a restoration of the urothelium and inflammation of the renal pelvis. So these are the things these are the conflicts which can affect the renal pelvis. So in kidney diseases, so in nutshell, there are 3 layers, germ layers are there. Depending upon the germ layer it is affected, the conflict changes. Okay. Now, how can we apply GNM in our practice, day-to-day practice? So I'm so thankful to Dr. Motiwala for giving us a valuable information about applying GNM in our practice. First thing which we have to do is, we have to understand what is the significant biological program associated with our symptoms. Whenever we see a patient with the symptoms, we should understand what biological significant program this patient will be having. First thing which we have to see. Second one, after finding the conflict, we have to make measures to resolve the conflict first, or downgrade the conflict as soon as possible. Seek some temporary distraction from that conflict and avoid tracks. Tracks you might be knowing. If again that conflict is there, or if then the memory, if it is there, again that conflict will come up. That has to be avoided. There are 5 methods to resolve the conflict. One is we can avoid that conflict, step back from the conflict and let it play out. That is one, avoiding. Or you have to accommodate with that conflict, or you have to compromise with that conflict. Means previously I told you, when 2 human beings are working together, there will be conflict. So either you have to compromise or you have to compete with that person. If you could able to know that it will work, then you have to compete it, or you have to collaborate. You both have to come together to develop a mutual understanding or beneficial solution. So we have to resolve the conflict. And The third one is you have to take the support of your love members, family members, and everyone so that it can be resolved. And the third thing is everyone has to maintain a healthy and positive lifestyle, like sleep well, regular checkups and screening, fight against infection, protection from skin, regular exercises, maintain a healthy weight and a balanced diet, and quit smoking, alcohol, and tobacco. Then the fifth one is gentle intervention, like our homeopathic medicines, with our homeopathic medications, or with, if some inflammation is there, we can put some ice packs, or if a severe vitamin deficiency like vitamin D deficiency is there, we can administrate vitamin D tablets. And the final one is we have to trust our body's ability to heal itself. We are just stimulating our body to heal by itself, because if we are resolving that conflict, the body will resolve by itself without having any side effect. And in homeopathic perspective, how can we go forward with this conflict? That is our main aim. The first thing which we have to see is what is the basic feeling of this particular person. So what all emotions are there? Total, what all emotions are there in a person? There are 5 primary emotions. First one is whether that person feels anger. Angry comes whenever there will be boundary violations and our needs has not been met. And if the patient is having sadness of loss of something, or it has gained something, then the person will have extreme joy. Extreme joy is also an emotion which causes problem. And if it is an uncertainty, anticipation, fear will be there in the third emotion. And if that person feels embarrassed, honor wounded, like that, pain about who am I, shame feeling. These are the primary 5 feelings or emotions which a person will have. And with the conflict, what type of emotion this person was having, and accordingly we have to select the medicine. Okay. And in this 5 primary emotions, in the high intensity, these are the rubrics which we can be taken into consideration. The high means it is syphilitic, depending upon the miasm which a person is carrying. The conflict, the severity of the conflict differs. If a person is carrying psoric miasm, and if the person is happy, then there will be low level of intensity, which is a psora. If the person is having a medium level, that means psychotic tendency, this person will have medium level of reaction. And if that person is carrying a syphilitic miasm, then higher intensity of feelings will be there, as a result of which we can frame or we can find the rubric accordingly. These are the feelings and the rubrics. These all are rubrics which can be taken for our consideration. Okay. Now we will go with the case. Before going with the case, I would like to mention one thing. One patient came to me with increased hypertension just 4 or 5 days before it started. It is not now. Before I know GNM thoroughly, the one patient came to me and told, Dr. Santhosh, I am having hypertension, and that was a lady who is talking in a weird tone. And
sorry, Dr. Santhosh, to interrupt. Let us know when you want us to stop the
I will tell you. Whenever we start that video, at that time we have to stop
recording.
Yeah, not now.
About your case. So when you let us know. Yeah. Okay. So
yeah, I will thank you. Okay.
Thank
so whenever that patient comes to me, when I take the case in detail, the patient told me last 5 days before. This is a very good example, but I was not knowing about the GNM thoroughly at that particular time. Some relatives comes to their house. They were in the swimming. The relatives were, children of the relatives were there, the swimming pool. At that time, this particular person, this husband and wife was there revolving the swimming pool, seeing what these children are doing. So jokingly, the husband just give a small push to the wife. She fall inside the swimming pool. So she was in a very bad situation at that. She doesn't know how to swim. And fortunately, the people who were there, they could able to took her out from the swimming pool. Also, this was the incident which happened 5 days before. She got angry with the husband. So much of problem was there, and her blood pressure was very high, and she came to me. So while taking this case, I have taken so just imagine if the hypertension is more, then which area will be the affected area? It is in the kidney parenchyma. I already explained that whenever the conflict comes, there will be necrosis of that particular area, hypertension, the constriction of that area will be there. As a result of it, hypertension will be more. So what was the conflict behind that one? I already told you, water conflict. I was not knowing that one. So the rubric which I have taken for that particular patient was fear of drowning. And I got the medicine, some 2-3 medicines were there. I got cannabis indica because the patient came to me with a delirious state. 1 dose of cannabis indica, 200, completely clears her hypertension. So after coming to the complete knowledge of GNM, we could able to understand it is the conflict which was there. So I have taken that fear of drowning. So whenever we could able to take the correct rubric, even though we are not having the knowledge of this GNM, we can come up with the medicine. But whenever this person is coming after 3 or 5 years, they will be completely forget about this incident which happened. But we know, GNM people or GNM knowledge people knows it is a water conflict. Then we can ask that question directly to that particular person. So is there any problem occurs like drowning or some water was falling in your house or something like that, so that they could be able to understand our selection of medicine, and our time will be, we can save time from taking the full case, and their belief in our system of medicine will be very high. This is the one thing that is before the knowledge. Now I am going to show you one case, which actually it is in Malayalam language. Here, Dr. Vanita, can you stop the recording? Because I don't want to share this one in the YouTube. Okay. Dr. Alphonse is there?
Yes.
Okay. Yes, you have
To take. Sorry?
The recording sign.
Okay,
No, Dr. Santhosh, recording is started.
Yeah, okay. Either I wanted to take or I took it, but I cannot able to eliminate. Whenever this is there and whenever this conflict stays, that is called hanging conflict, then more thyroid hormones or hyperthyroidism comes first, because lack of cell necrosis comes, more thyroid hormones will be producing, followed by hanging hyperthyroidism. This is the basic thing of hypothyroidism. Hyperthyroidism means it is just a hanging conflict that stays low. But I would like to come out hanging conflict. Constantly that conflict is relapsing. Got it? Because in endodermal tissues, laterality doesn't work. Especially, mainly in ectodermal diseases work. But left lobe of the thyroid and right of the thyroid is having ingoing morsel and outgoing morsel. All organs with endodermal is with morsel conflict. Okay. Very good, Dr. Mamada. Any other questions? So we have to include GNM knowledge in our day-to-day practice. That's all. Anything more? Over to Dr. Ritu.
Thank you, Dr. Santosh, for a wonderful session and the case presentation that was extremely good and helpful in educating us the concept of GNM. And thank you, Dr. Ehab, for the beginning of the session, which was really overwhelming and very educative for us to understand the concept and relation of GNM with how we can correlate GNM with homeopathic also. With this, we will wind up the session, and I would like to thank all the participants who were there for the session and supported us in conducting it through. So we would like to take your leave in this. Thank you once again. Okay. Bye-bye. Thank you, Dr. Santosh, Dr. Ehab. And thank you, Dr. Alphonse, for being a very good translator as well. Thank you.
Distant translator.
Distant translator. I know you're handling it from Bangalore, but
From India.
thanks a lot. Yeah. Okay. Bye-bye. See you.
Thank you. It was wonderful. Thank you.
Okay.